We have in this country the highest maternal mortality ratio in the world of any non-conflict country. In our hospital we have counted our own maternal mortality ratio, which is about 350 women dying per 100,000 deliveries. That means one woman a week or a little bit more.
The Rose Project is a HIV and AIDS humanitarian agency. So we had to think closely about addressing a maternity hospital. But of course, if you look at the figure of 30% of the women attending this facility here are HIV positive. Within this hospital, it is imperative that we link in to the existing services in Lilongwe in providing a state-of-the-art prevention of mother-to-child transmission here, given that that is the second most common form of transmission of the virus in pregnancy, during delivery or in breast milk. So we have to look at ways of addressing that. So that's what brought the Rose Project in on this.
We are running this obstetric unit, which has 12,000 deliveries, but we also have gynecology, which is the whole other side of it, and we are only two. That means at any given time only one obstetrician is in the labor room.
You have somebody who comes to these institutions, she delivers alone on the floor. That experience is not a good experience which one would want happen to you. So they go home, they tell friends that when I went to the hospital, this is what happened to me. I'm sure those friends will not want to come to the hospital because they'll feel that it's better for them to deliver somewhere where there is somebody to attend to them rather than coming to the hospital.
This is a terrible situation. It's really a disgusting situation if you look at it from the point of view of the mothers, especially since we have at the moment a labor room where mothers have no privacy whatsoever. Mothers lose their babies, say nothing. Mothers lose their lives, nothing is said. We have to give our patients a voice. And the idea of having this new hospital, for instance, where it is possible to deliver in dignity, in a humane way, that is one of the possibilities to address that problem.
We know that 14% of our pregnant moms are HIV positive, but then it is difficult to catch up and test them and discuss issues of HIV because the conditions there are not really good. So there is a big gap of actually pregnant moms who are not tested. So what we're trying to put forward is to make sure that every expecting mother should be actually tested.
Now you are helping us to have this new hospital, which is a great first step. And just imagine, we would be able to do 12,000 times a year, have a mother leave our place, feeling that she has done something very special, has given birth to her baby. She's done it, we assisted, not the other way around. She's done it, we assisted. And it's healthy and it's fine. She comes out of this being a better person, being confirmed in her worthiness. And that we really have that place where women come and experience one of the highlights of their lives, where they come and become mothers and feel this was one of the best days of my life. That's what we want.